My name is Tomoya Tanaka, and I am a student registered nurse from UTS. When working as a nurse, the number of the patients you are allocated to look after may vary by what type of ward you work in, or what skill set you have, and so on. The title of this presentation is The Impact of Nurse-to-Patient Ratio on Patient Safety and Healthy Workplace. This presentation consists of objectives, background, outline of the topic, and conclusion. The objective of this presentation is to educate auditory, visual, and kinetic learners regarding the significance of nurse-to-patient ratio and how effective leadership can improve patient outcome and workplace environment through evidence-based appropriate staffing. All of the information provided in the presentation was gained through timely and current research on the topic and policies outlined by New South Wales Health. First off, I am going to talk a little bit about background on this topic. Nurse-to-patient ratio is defined as the number of nurses working on a particular ward, unit, or department in relation to the number of the patients they look after. Appropriate and effective staffing is an essential element not only to provide a high quality and safe patient care, but also to create a healthy workplace for nurses. However, there has been only few documents regarding rostering guidelines, training, or education available for those with staffing responsibilities. On top of that, there are other factors contributing to inadequate and inappropriate staffing, including cost-cutting and low budget in hospitals, and rising demand for healthcare resulted from an aging population, combined with increasing costs of technology and treatment. At present, in New South Wales, the main resource used for rostering is a tool called the Nursing Hours Per Patient Day, also known as NHPPD. However, currently there is no mandated requirement for nurse-to-patient ratio in New South Wales. Since in an extreme case, a nurse had to care for 11 patients on her own in both rural and regional hospitals. In 2018, more than 100 nurses and midwives rallied outside New South Wales State Parliament, asking for formal nurse-to-patient ratio in all hospitals. Following this event, although the Health Minister Brad Hazzard said that he understood Nurses Association perspective on the call for a mandated nurse-to-patient ratio, Premier Gladys Berejiklian pulled back, refusing to make a commitment. Therefore, there is currently no formal nurse-to-patient ratio system guarantee in law to help manage ongoing demand across the state. Now, moving on to outline of the topic. Why is nurse-to-patient ratio important? This is because nurse-to-patient ratio has a huge impact on patient safety. A great deal of global research confirms that insufficient or inappropriate staffing may lead to an increase in the risk of compromised care, adverse events for patients, poor clinical outcomes, inpatient mortality, and patient dissatisfaction of the experience in hospital. For example, a comprehensive study conducted by the University of Pennsylvania in 2002 found a clear connection between nurse-to-patient ratio and patient mortality, showing that mortality rate for surgical patients was higher in hospitals in which nurses had greater number of patients to look after. Technically, it found that the gap from 4 to 6 and from 4 to 8 patients per nurse would be accompanied by 14% and 31% upwards in mortality respectively. Also, other study found that every extra patient per nurse, over 4 patients, increased the chance of the patient dying within 30 days of admission by 7%. Another reason why good nurse-to-patient ratio is important is that inadequate or inappropriate nurse-to-patient ratio has a detrimental impact on the health and well-being of nurses. Increasing workload caused by poor staffing may result in burnout, absenteeism, job dissatisfaction, attrition, and poor retention, which all may affect the quality of patient care. The results of the analysis of the survey targeting 10,184 nurses showed that nurses with larger number of patients were much more at risk of experiencing burnout and job dissatisfaction than nurses with a smaller number of patients. For instance, the study found that nurses in hospitals with 8 to 1 patient to nurse ratios would be more than twice as likely as nurses with 4 to 1 patient to nurses ratios to display high emotional exhaustion, and 1.75 times as likely to be dissatisfied with their jobs. When nursing staff are overstretched because of inadequate staffing, they have to be the ones who faces the consequences and suffers personally. The nature of nursing can be stressful, but being unable to stay hydrated, eat, or go to toilet for a long time affect their well-being. Having to work overtime despite tiredness will lead to burnout, all of which can cause excessive amount of stress and will eventually take its toll not just on individuals but also on the whole team. Safe evidence-based nurse staffing means that an appropriate number of nurses is always available across the continuum of care with the appropriate mix of education, skills, and experience to meet patient care needs and to provide supportive working environment and conditions with staff so they can deliver quality care. Effective leadership plays a vital role in achieving this and maintaining patient safety and healthy workplace environment. Leadership is about influencing others to attain common objective. In nursing context, it has been defined as a complicated and multidimensional process that encompasses providing support, motivation, coordination, and resources to empower individuals and teams to accomplish collective goals. Study shows that positive leadership has been directly associated with patient safety across a wide range of clinical settings. For example, effective leadership has been correlated with lower rates of urinary tract infections, pneumonia, and brain hemorrhage in neonates, as well as lower rates of medication errors and patient falls. Nurse leaders who can support other staff and improve workplace environment through developing solid working relationship with staff members, acknowledging individual contributions, and creating informal opportunities for staff to come together are crucial to staff well-being at work. Moreover, a strong working relationship with staff members allows nurse leaders to understand appropriate staffing levels and mix, and to control and adjust staffing levels to ensure patient safety, hence improving staff allocation and patient safety. Through creation of such positive and safe work environment, the job satisfaction will increase and the stress level will decrease, leading to better retention and reduced possibility of burnout. Unlike managers whose job is recognized as position of power within the hierarchy of an organization, leaders do not have to be in a particular role or position. Leadership is often distributed throughout the organization, and leaders can be found at all levels of the organizational hierarchy. So anyone, including a new graduate RNs, can be a good leaders within their scope of practice too. According to Nursing and Midwifery Board of Australia, our registered nurse has obligation to provide comprehensive, safe, quality practice to attain agreed goals and outcomes that are responsive to patient needs, and use the appropriate process to identify and report system issues accompanied by potential and actual risk, and where practice may not meet the expected standards. Also, nurses have responsibility to maintain their own health and acknowledge their physical and psychological strength and limitations. The point is, if you feel your practice is being compromised by insufficient or inappropriate nurse-to-patient ratio, you, new graduate registered nurse, have to act on it. By recognizing that nurse staffing affects patient, nurse, organizational, and system outcomes, informing senior staff, team leader, or nursing manager of unsafe nurse staffing situations, and researching and using outcome measurement data to inform decision making in regards to safe and effective staffing practices. In conclusion, we learned background of nurse to patient ratio and staffing, current practice of nurse to patient ratio in New South Wales, the significant impact of nurse to patient ratio on patient safety, and the significant impact of nurse to patient ratio on workplace environment, how effective leadership can contribute to improve nurse to patient ratio and staffing issue, and what you can do about the problem as a new graduate registered nurse. Nurse to patient ratio and staffing issue is something you will be likely to come across in the future as a new graduate nurse. Having reviewed this presentation, I hope you are aware of the importance of the issue, how it affects both patient safety and workplace environment, and how effective leadership can help resolve or mitigate this problem through evidence-based staffing. Thank you.